are all today 60 plus by any calculation. You are entering a stage, a new stage, and probably you are interested how we fellows have managed to live after 60 years. After 60 years, the one thing you have to do is you have to change your attitude towards life. Your children are there, you can't treat them as your children, you have to treat them as friends. You will be getting your in-laws, maybe son-in-law, daughter-in-law, but you have to treat them as your own son or daughter. You can't treat them as a routine, olden day son-in-laws or daughter-in-laws. You have to change your attitude. You have to treat your wife in a different way because she will be attaining menopause or already attained menopause. And you know during menopause, lot of changes are there and you have to adjust yourself to that mood swings. So, psychological changes, if you don't understand them properly, it's a perpetual thing to cause misunderstanding and cleavage in the harmony in the life. So adjust yourself for all those things. I don't want to give a lecture. I'm a professor, supposed to be, and I'm used to talk. To what extent I talk is relevant, we are not sure. You know, the professors talk a lot of things, and they know very well that 50% of what they talk is not correct, but unfortunately they do not know which 50% is not correct. All that I can tell you is this. I am sure quite a number of teachers who are here would like to talk, so I don't want to waste your time. But I will tell you a few things which may help you to reach a century in your lifetime. One, keep your physique active. Be active. Start walking. If you have not been walking, start walking. Exercise, you know, is one of the important, easiest way of keeping your health well. Till late, I used to walk regularly half an hour. Whatever may happen, let heavens fall down, but walking must be there. I used to walk. So keep your physique, walk daily. Whatever happens, walk and walk. Keep your mind active. This is very important. A few days ago, I met some of my students. They have retired. After holding very high posts. I asked them, what are you doing? They said, sir, we have relaxed. We are relaxing, we are retired, we are not doing any work. I said, I am sorry, you should not do that. You should keep your brains active, continue your work, because if you have been very intelligent throughout, and if you don't keep your brain active and give it the proper stimulus, definitely it is going to degenerate. Even otherwise it will degenerate, but it will degenerate fast. Probably it may end up with Alzheimer's. So keep your brain active. Keep reading. You won't believe me, even today, at least half an hour, I read medicine. And my Bible is current medical diagnosis and treatment. Every year I get the new edition and read. I am not a back volume. So I want to keep myself updated and I do it and try to deliver goods to my patients. I not only preach but I practice. Even today you will be surprised to know that I attend to my patients, 3 patients 3 times a week, spend 6 hours with them, do a lot of counseling, lot of teaching to them, so with the hope that something enters to their brain and they will depart that part of knowledge to somebody else. I miss my students very badly, even now, and I treat my patients as my students. Well, as age progresses, 2 things bother us. One, loss of memory. Second, depression. I am sure all aged people have to pass through this stage. Memory starts failing, and then there is depression. Maybe reactive depression or maybe endogenous depression, but depression is there. The only way to overcome this is, of course, the only way to avoid going to a psychiatrist, unless of course if it goes to a stage where we have to go sometime or other later, do meditation. Spend some time in meditation. You may believe in God, you may not believe in God, but my advice is this: believe in something which is more superior to you, from which you can imbibe energy, by which you can invoke the strength which is there within yourself. My concept of God is different. I believe in God, but my concept of God is different. God is nothing but energy. Energy, energy, and energy. Call it cosmetic energy, call it by any other name. It is energy. So imbibe that. For that you require meditation. Spend every day some time in meditation. By this you can overcome your depression. Third, so I have told you that you have to keep your physical part of it active, mental part of it active. Third, don't forget the sexual part of it. You have to keep your sex intact and try to keep it well, because science has proved that sex is an important part of your life, and that's the one which keeps you active, energetic, and helps you to give the best to your profession as well as to the society. You may think sex is vulgar. Certainly not. Sex is one of the greatest pleasure God has been kind to give us. Let me ask each one of you, are you, any one of you, prepared to stay in this life with no sex? So, mode of sex may be different as a result of age, but try to keep it stimulated. Science has proved that sex, indirectly or directly, reflexly or otherwise, improves the cardiac circulation. Well, these are the three things which you have to keep it active. The fourth one, diet. As you pass your 60 years, regulate your diet, have more discipline in your diet, have frequent small meals, don't overeat, try to eat more vegetables, more fruits, fibers. So that will again help you to keep you young. All these principles I am not preaching, but I have been following. Now the last one is the drugs. I would like every elderly person to have, unless there is contraindication, 50 to 80 milligrams of aspirin per day. There are controversies, but there are more evidence to show that these things will help as you grow old. So take aspirin 50 to 80 milligrams, small doses. It will not bring about any severe side effect. Second, most important one also is ARB. Either the ACE inhibitors or the ARB in small doses. It has been proved beyond doubt that if you keep your blood pressure even at the normal maximum level after 60 years, your chance of getting a stroke, your chance of getting a cardiac infarction is much more than when you keep your systolic pressure less than 140. So even if your pressure is 140, take small doses of ARB or ACE inhibitors. ACE inhibitors or ARBs have got the property of preventing stroke, may prevent cardiac infarction may give you long life. The third one is 2 cups of coffee per day. Caffeine. Caffeine is another drug which can keep us active, mentally, physically. So I think that's the one that may help you. The fourth one is small doses of statins. Statins have proved that small dose of statin in elderly age group not only prevents the possibility of stroke and infarction, etc., and may even resolve whatever patches are there, whatever narrowing is there. So small doses of statin will help you. The fifth one, the important one, is vitamin D. Vitamin D, today I call it a Sanjeevani vitamin. I call it Sanjeevani vitamin because this is a nomenclature found out by me. You don't find it in literature. Sanjeevani, because I call it because it has got the property not only for absorption of calcium and strengthening the bone and all, but it's an anti-infective vitamin. It improves your immune process. It is anti-cancer. It prevents stroke. It prevents a possibility of myocardial infarction. It makes a diabetic patient respond much better to the drugs. So what more do you want? So that's why I call it a Sanjeevani vitamin. Take vitamin D without fail. 2,000 units per day. Every day you take vitamin D. I think with these Pancha Sutras, you may be able to live few more years than the usual one. Well, my dear students, I wanted to talk a little more, but I look at Hande's face, Narayan Swami is looking very, very grim, and Professor Vittal is trimming his mustache. So, I think I should not talk more, stop here. It has given me a wonderful pleasure today. I remember my last class in 1981 in Bangalore Medical College. I talked about meningococal meningitis. It was such a wonderful experience for me. It was my last lecture in my lifetime. I found the whole hall overbrimmed with students, and students waiting outside on the corridors of Bangalore Medical College. I got a tremendous pleasure that day. I missed all those things all these years, but today I get the same pleasure. Thank you very much. Forgot to tell, in my teachers also, a wonderful opportunity for us to come and meet you, exchange thoughts, and bring back our nostalgic memories. It was a wonderful experience. We should thank you very much. Thanks a lot. And we feel that more and more this type of unions, reunions should take place, and others should follow your footprints. Thank you.
ಮನಸ್ಸು ಮುಗ್ಧವಾಗೋಗಿದೆ, ಹೃದಯ ತುಂಬಿ ಬಂದಿದೆ ಡಾಕ್ಟರ್ ಕೆ.ಜಿ. ದಾಸ್ ಅವರ ಮಾತುಗಳನ್ನ ಕೇಳಿ. ಅವರ ಅನುಭವದ ಮೋಸೆಯಿಂದ ಬಂದಿರುವಂತಹ ಮಾತುಗಳನ್ನ ನಾವು ಸದಾ ನೆನಪಿನಲ್ಲಿ ಇಟ್ಕೊಳ್ತೀವಿ. ಹಾಗೆ ಅವರ ಆರೋಗ್ಯದ ಗುಟ್ಟು 86 ವಸಂತಗಳನ್ನು ಕಳೆದು 87 ವಸಂತಗಳವರೆಗೆ ಹೋಗ್ತಾ ಇರುವಂತ ಅವರ ಆರೋಗ್ಯದ ಗುಟ್ಟು, ಯಶಸ್ಸಿನ ಗುಟ್ಟು, ಪಾಸಿಟಿವ್ ಆಟಿಟ್ಯೂಡ್ಸ್, ಈ ಗುಟ್ಟನ್ನೆಲ್ಲ ಅವರು ಇವತ್ತು ರಟ್ಟು ಮಾಡಿದ್ದಾರೆ. ನಾವು ಅದನ್ನ ಅನುಭವಿಸ್ತೀವಿ. ಸೊ ಹಾಗೇನೆ ಬಹುಶಃ ನಾವು ಎಷ್ಟು ಜನ 86 ವಸಂತಗಳನ್ನ ನೋಡ್ತೀವೋ ಗೊತ್ತಿಲ್ಲ, ಬಟ್ ಒಂದ್ ವೇಳೆ 86 ವಸಂತ ನೋಡಿದ್ರೆ ಅದು ಡಾಕ್ಟರ್ ಕೆ.ಜಿ. ದಾಸ್ ಅವರಿಂದ ಅಂತ ಹೇಳಿ ರೋಗ ಚಿಕಿತ್ಸೆಯಲ್ಲಿ ಭದ್ರ ಬುನಾದಿ ಹಾಕಿ ಸಾವಿರಾರು ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಆದರ್ಶಪ್ರಾಯರಾದ ಡಾಕ್ಟರ್ ಕೆ.ಜಿ. ದಾಸ್ ನಿಮಗೆ ದೇವರು ಆಯುರಾರೋಗ್ಯ ಭಾಗ್ಯ ನೀಡಿ 100 ಶತಕ ಪೂರೈಸಲೆಂದು ಹಾರೈಸುತ್ತೇನೆ. ವಂದನೆಗಳು ಹೋಗಿ ಕಲ್ಪನಾ, ಚಿಕ್ಕಣ್ಣ, ಉದಯ್. ಈಗ ಡಾಕ್ಟರ್ ಸಿ ವಿಠಲ್ ಅವರನ್ನು ವೇದಿಕೆಗೆ ಆಗಮಿಸಬೇಕು ಅಂತ ಕೋರ್ತಾ ಇದ್ದೇನೆ. ಅವರನ್ನ ಡಾಕ್ಟರ್ ಬೀನಾ, ಮೈಕ್ರೋಬಯಾಲಜಿ ಪ್ರೊಫೆಸರ್ ಜೋಡಿ, ಅವರು ಕೋಲಾರ ಮೆಡಿಕಲ್ ಕಾಲೇಜು, ದಯವಿಟ್ಟು ಗತ್ತರಬೇಕಾಗಿ ವಿನಂತಿಸ್ತೀವಿ. ಡಾಕ್ಟರ್ ವಿಠಲ್ ಅವರು ಪ್ರಖ್ಯಾತದಿಂದ ಪ್ರಾರಂಭಗೊಂಡ ಶಸ್ತ್ರ ವೈದ್ಯ ಶಾಸ್ತ್ರ ಶೈಶವಾವಸ್ಥೆಯಿಂದ ಪ್ರೌಢಾವಸ್ಥೆಗೆ ತಲುಪಿದಾಗ ಡಾಕ್ಟರ್ ಆದಿಕೇಶವರವರಿಂದ ಹೊಣೆ ಸ್ವೀಕರಿಸಿದವರು ಡಾಕ್ಟರ್ ವಿಠಲ್. ಶಸ್ತ್ರ ವೈದ್ಯರಲ್ಲಿ ಸಾವಿರಾರು ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ವಿದ್ಯಾದಾನ ಮಾಡಿದವರು ಡಾಕ್ಟರ್ ವಿಠಲ್. ಅವರ ಸಂಕ್ಷಿಪ್ತ ಪರಿಚಯ ಮಾಡಿಕೊಡ್ತಾರೆ ಡಾಕ್ಟರ್ ರಾಜೇಂದ್ರ. ರಾಜೇಂದ್ರ ಸಹ ಪ್ರಖ್ಯಾತ ಅಸ್ಥಿ ಶಸ್ತ್ರ ತಜ್ಞರು, ಆರ್ಥೋಪೆಡಿಷಿಯನ್.